Joining us this morning, our friends from Titusville Area Hospital. Kelly Clark's here, and she brought in Dr. Lisa Rubin, and we'll chat with her in just a moment. But Kelly, good morning.
Good morning.
I'm great. Good to see you this morning.
Good to see you.
What's been happening?
Well, of course, I always have a lot to tell you. So one of the things that is happening at the hospital is, I know I talked about it a little bit last time, but we are having our golf scramble. It's set to be on May 25th. There are lots of great opportunities to come out and golf with us. Last year we had 32 teams, which was quite a giant support. It's through the Titusville Hospital Foundation. This year's profits will benefit the hospital bed campaign. So we're looking to replace 25 of our inpatient hospital beds at the hospital, which is a pretty big project. It's about $385,000. So far, we have raised $47,000, so we're on our way. Remember I told you what I wanted for Christmas to be able to buy one bed, so we got there.
Nicely done.
So we're still working towards that. This is, the Golf Scramble is the primary charity event for the foundation. A lot of local businesses help us out. If anyone out there is looking for an opportunity to support the hospital this year, this is a really great way to do it. We accept raffle baskets, any kind of raffle prizes. You can call the hospital and ask for the foundation office, and we'll put you in the right direction.
That's wonderful. Now, are you bringing this up because there's so much snow out there and people are starting to think about getting out there and playing golf?
Yeah, I know that's all we can think about.
Wishful thinking, right?
Very, yes.
Hard to complain, though, when we've had the winter that we've had.
Yeah, it hasn't been bad lately.
Yeah.
Maybe not the last couple of days, but.
But this is really one of the first big tournaments of the year. That's a lot of fun, and as you say, I mean, a great cause. And
yeah, we always have a lot of great prizes, a lot of great sponsorships. Donovan Bauer come out. They do a hole-in-one contest. Last year we had quite a few places in the area that gave us great prizes for our guests, so yeah.
Wonderful. Now I know there's some other hospital news, but let's save that for a moment and
all right.
Bring in Dr. Lisa Rubin. Good morning, good to see you.
Good morning.
How are you?
I'm well, how are you?
Good. January is a big month. What's January?
So January is National Cervical Cancer Month, and it's to bring awareness to cervical cancer as a continued issue for women. I usually like to just start out, what is cervical cancer? It's a malignant tumor of the opening to the womb. It used to be the leading cause of cancer in women in the world, in the United States, the leading cause of cancer death in the United States. Leading up to, when a woman first gets cervical cancer or pre-cancer, it's completely asymptomatic, so they don't have any symptoms. Later on in the process, they may notice some irregular bleeding or bleeding with intercourse, but it's one of those kinds of cancers that used to surprise us. We were very fortunate in the 1940s when Dr. Pap invented the Pap Smear, which is a way for physicians to sample cells when women come in for their annual visits and look at them and determine if there were any abnormalities in the cells. And that actually decreased over the next 10 years the cancer rate and the cancer death rate by 50%, which was really quite significant. Wow. Yes. And then in the early 1990s, we developed the ability to be able to find and detect the human papillomavirus. And it turns out that over 90% of all cervical cancers are actually caused by a virus. The virus being known as the human papillomavirus. It is a sexually transmitted disease, and it is actually completely preventable. So by being able to detect this virus, that really also helped us to be able to bring the cervical cancer rate down. And then, the biggest thing that we've been able to do in, this century has been the invention of the Gardasil Vaccine. And vaccination, unfortunately, in this country, vaccination took off very slowly, and most young adults, we only have about a 22% vaccination rate in young adults, which has dropped the cancer rate down by 20%. Pediatricians around the country tell us that they're getting 60% of the children vaccinated, which means that this rate should continue to come down.
What's the age that someone should get vaccinated?
So the preferable age in this country is 11 to 12.
Okay.
And if you get your vaccine before the age of 15, you only need 2 shots. If you get your vaccination over 15, then you need 3 shots. And most insurance companies in this country will only pay for the vaccine up through the age of 26. So we really want to get all young adults who are under the age of 26 vaccinated, and that's men and women. Originally, it was approved just for women, but it was also found shortly after that most oral cancers, cancers of the tongue, cancers of the tonsils, cancers of the throat, were also caused by HPV. And that's for men and women. And so it was then changed so that both men and boys and girls should get this vaccine. And in Great Britain, where they have an 80 to 90% vaccination rate, their rate of cervical cancer has dropped a further 87%.
Really?
Yes. So that's really significant. Now, it used to be that women would come in every year for their Pap smears, and that recommendation has started to change, partly because we are seeing these decreases, and partly because we're now able to detect the HPV component of this, and that's helped us to be able to reduce the frequency with which women need to get Pap smears. My concern, and I know a lot of other doctors' concerns as well, are that women have taken this, oh, well, if I don't need a Pap smear for 3 or 5 years, I don't need to go to the gynecologist for 3 to 5 years. And that's not the case. We want you still to see us every year. You're more than just a cervix. So, we evaluate all different kinds of female issues, as well as looking for different kinds of female cancers. So don't miss your yearly exam. But the current recommendation is not to do a Pap smear under the age of 21, and between 21 and 30, to just do Pap smears, and then if the Pap smear is abnormal, then they would go on to test for HPV. But then once you hit 30, to have a Pap smear and an HPV test, at least once every 3 to 5 years. In my practice, I like to do the HPVs every 3 years over the age of 30. And then once you turn 65, if you've never had an abnormal Pap smear and you've gone every, then the recommendation is that you could stop. You don't have to stop, and Medicare will pay for Pap smears every 2 years. Since the highest frequency, so we still see about 20% of our cervical cancer cases in women 65 and older, and that's because none of them vaccine was not available for them. I still think that women over the age of 65 need to come in, for their Pap smears every 2 years, but for their annual exam every year. It's interesting that the most commonly cervical cancer is diagnosed between the ages of 35 and 44.
Oh, wow.
And that cancer's probably, that HPV's probably been brewing in there for 10 to 20 years. So one thing to know, if you are told that you have HPV, that does not mean you're going to get cancer, you're going to get cervical cancer. The majority of the HPVs the immune system is going to take care of it, and it's going to go away. It takes an average of about 24 to 25 months to go away.
Really?
Yeah, so it takes a while. But the majority of them will. It's the ones that don't, the smaller percentage that persist, that put those patients at risk. Now, again, just because you have HPV doesn't mean you're going to get cervical cancer, but if you smoke, that you're at much higher risk of getting cervical cancer. Smoking seems to be a cofactor for this disease. If you have been diagnosed with HPV or precancer of the cervix and you're a smoker, that might be a good reason to really think about quitting smoking. So I think the takeaway that I want to leave here is that one, it's a preventable disease, and the major prevention that we have is vaccine. And get your children vaccinated. You will be doing them a big favor, and it's not just for cervical cancer. The HPV vaccine, otherwise known as Gardasil, has reduced the incidence of oral cancers, anal cancers, and other cancers of the female system, vulva, vagina, and cervical. And it also reduces the incidence of penile cancer. So we have many reasons to, for our children to be vaccinated for the HPV vaccine. And then the other takeaway is that, Pap smears are important. If most of the time, if I see a woman in her 60s that has cervical cancer, and I have actually diagnosed 2 cervical cancers since I've been here in a year, than a year and a half, it's because the woman, they weren't getting their regular Pap smears. They hadn't had it in 10 years. So if you're, above the age where you didn't get vaccinated, you still, will most likely have been exposed to HPV at some point in your life. They did, in the 90s, they did a study looking at women who presented for birth control, and they found that over 60% of those women were HPV positive and had no idea. So it was very prevalent. And so in my age group, and anyone really at this point who's probably over the age of 35, still is was exposed to it and was unvaccinated, and really.
So that's that age group right now that you should be
focused on,
okay.
And that's the age group also where we see the most common cancers is 35 to 44.
Oh,
wow. But we also see it in the 50s, and so for those of you, you really need to be getting your Pap smears very regularly, and you can ask if your doctor, do you do HPV? Because if they say no, then you can say, well, could you do one for me? I would like an HPV done. And the combination of the two is really the best way to pick up abnormalities.
There's a lot to remember, right? Like, how many years, should I have this done? How many, what's the time frame between this test and I get another test? The best thing to do is have that conversation yearly with your doctor, right?
Exactly.
And then you don't have to worry about that. They'll tell you.
Exactly. We keep track of that for you. We keep track of what test you need to have done when. So if you come in yearly, we'll let you know, when you need to have your Pap smear. We'll let you know when to send, we'll send your HPV for you. When you're at the age for mammogram, we'll let you know. So yes, the best thing to do is to come in and have your yearly visit.
And keep that appointment. Don't go, I think I'll reschedule, and then you kick it down the road. Keep your appointments, right?
Yep,
Keep your
absolutely.
scheduled appointments.
Absolutely.
Some great information there, Doc. And I think the big takeaway there is preventable.
Yes, preventable.
Wow.
Exactly.
Kelly, back to you. There's
Yeah.
some other things happening at the hospital. What's
I do
going
just
on?
want to mention, if anyone is looking to, come in and see Dr. Rubin, she's really great. You can set up an appointment anytime with her. The direct line to call is the 9770 number. That'll get you right to her office. You can schedule an appointment. They have a lot of availability. Can fit you in, work with your schedule. So, if you're out there thinking, I don't really have time for this, just give their office a call. They accept all insurances. So, yeah.
Okay, great.
Also, speaking of vaccines, I know she talked a lot about vaccine. We are still offering the COVID Pfizer vaccine, which we have been for quite a while. We're still having vaccine clinics every Wednesday in the hospital. I know prior, it was after you got your second dose, you had to wait 6 months, but it's now 5 months. So if anyone's waiting to, get that scheduled, you can now schedule that 5 months after your second dose instead of 6 months. And the CDC also is allowing for kids between the age of 12 and 15 to have their booster shots. So we are actually doing one of those clinics today in the hospital, but you can go on our website anytime, sign up for your booster or your first or second dose, wherever you are in the series. You can call our COVID line if you don't want to use our website. It's the 827-5700. I almost had it.
Yeah, you did. Well, you get a lot of phone numbers up there.
I do, yeah. I'm just making them up. They're not real.
Well, call and get that set up. And that's every Wednesday, you said?
Every Wednesday, we have a clinic. Mm-hmm.
Okay. I want to go back real quick. The golf outing. Can folks start registering their teams?
Yes.
Okay.
Yes, we sent out some save the date cards. So make sure you mark your calendars. That way you have availability that day. But like I said, it is May 25th. You can go online. All of the information is updated on our website. You just go to the foundation page and it's right there. There's sponsorship information. There's registration for team information. We have a whole letter that kind of goes through the entire outing, what to expect. It is at Cross Creek this year, which is where we have it every year. It's really great there. We have lunch, drinks out on the course for you. There's a little breakfast set up in the morning during registration. So yeah, it's a really great outing.
And everybody has such a great time. So
And
it supports such a great cause too.
Yes.
And real quick, talk about the beds again, because this is a great upgrade at the hospital.
It is. So I was talking to our nursing supervisor and I said, how old do you think, some of these beds are? Because, just put it out there, what we're looking for. And she said, I don't know. She said, I've been here for a really long time and some of them are older than me. So, that's concerning. So they're really great upgrades. So a lot of the technology obviously has changed. And with COVID, all of our older beds, we weren't completely full all the time. So during COVID, we've had a lot more patients staying, a lot more inpatients. So, looking at this is more of an important project. We would use our best beds. Well, now we're using all of our beds. So we need them upgraded right away. Some of the great upgrades that we have are fall prevention. They have ability to be lowered to the floor, so patients don't have the fall risk that they would being higher up. And also they have the ability to be wireless, meaning that you're not hooked up to all of these things while you're laying there. The nurses can actually weigh you while you're in bed. You're hooked to the nurse's monitor out at the nurse's station. So it's just a really great upgrade. I think it's going to be really great for our patients and our hospital and our staff.
I would imagine that would also save time if you're taking a patient from a room and you need to get them somewhere else.
Yes, but let me unhook a million things.
Yeah, no, exactly.
Yeah. So it'll be really nice for our staff. Our staff has been working around the clock, very hard, extra shifts, to cover all of our patients. And during this time, I think anything to make their lives easier is going to be great.
All right. Well, Kelly, thank you for all the great information. Doc, thank you again for the wonderful information as well. And again, the takeaway is preventable. Call and schedule that appointment. If you have an appointment, stick with it.
You got it.
And if you don't have a doctor,
we're here.
Excellent. Great to see you. Thank you so much for your time, as always. Always enjoy the conversations. Kelly, thank you.
Thank you, Luke.
And again, main number for people to call with any of this stuff, just in case.
Oh, with anything, you can just call the hospital line directly. It is 827-1851.
I just want to see if she had one more phone
quiz.
number out there. Yeah. Hey, thanks. Take care.
Thanks, Luke.